degrade, I might disappear from the screen because I found that not having the video on sometimes helps with those things. But so far, so good. We're okay. Um, okay, so I would like to make sure that we talk about Chore to CFC, Chore moving to CFC, and new day hab regulations. See if I can get rid of some of these things here so they're not in my way. That's a problem with just having one little screen on a laptop. I can't move things around a whole lot. Chore to CFC, new day hab regulations, our move to our new building, and then simple updates on Harmony, and a big thank you for filling out our survey. Go ahead and put in your questions as they come to your mind. We'll do our best to answer them here in the session. And if we cannot do that, we'll certainly take note of your questions and get back to you on answers if we can. Okay, so let's, I see your questions coming in. Go ahead and keep on doing those. Let me take a look at Chore to CFC. So let's look at this. This is our regulation page, information page about regs. And what we have here is a little bit of info about Chore to CFC down at the bottom, moving Chore into community first choice, signed regulations, conditions of participation for waiver and CFC Chore, and CFC Chore, rates, and PCS and CFC. So that kind of encompasses the whole boundaries, if you will, of Chore moving to CFC. I'll open one just so we can look at it. I'm not going to read these out to us, but I just want you to see that it's there. These were signed and they're, let's see, these regs always look like this when they're new, like this. They're effective January 1, 2021, and that's how they look when they're signed. They literally have a PDF document that goes out like this. Basically, there's not a whole lot of content here. I can summarize for us. Chore is moving under CFC, just like PCS did for folks with level of care, and nothing has changed about that. You still have to have level of care for CFC. Level of care for any of the waivers, or even behavioral health level of care for an institution. And then you could choose these services that are under CFC. So Chore is moving under. And so what we are trying to do is make a better transition, if possible, than when we started with the first one we did, which was PCS, so that people are more aware of what's happening and how it's going to work. There isn't a whole lot of difference from what care coordinators are familiar with, because you're familiar with requesting, of course, PERS and our CFC PCS in your waiver process and your support plan process if the person just has CFC. So nothing about that has changed. Chore will come under CFC. It'll have a new code for the provider to begin billing. Nothing has changed about the amounts that are authorized. Nothing about the definition of chore has changed. A person a person will still have to choose either Chore or PCS IADLs to fit their needs for that type of service. So it doesn't mean that they could be done together or anything like that. Nothing has changed about that. There will be a letter going out to people we serve and to our care coordinators that states Chore moving under CFC. And the letter itself hasn't been signed by our director as of this moment, but we are doing our best to make sure that it's plain enough language for anybody to understand. So that's good for me, good for you, and good for the person we serve. So after the first of the year, Chore will only be available as a CFC service. So a person can choose not to have Chore, and if they don't have any Chore service at all, and they are not getting it under IADLs with PCS or CFC PCS, that's how they could opt out. But there is no such thing as chore on a waiver. So that means they wouldn't have anything, but that's a choice. If they want to have their chore-like services done under PCS, CFC, PCS, IADLs, they could choose that. And that's the basics of how it's going to work. And of course, we're working on moving that whole story into Harmony so that when we get farther into Harmony training, that we'll be able to help you select services that are under CFC on behalf of your client. And that's the basics right there. I just wanted to let you know that Chore is moving to CFC. It may or may not impact your client very much. They already have Chore, they'll become a CFC, recipient, and that'll impact your processes, but not generally for the person. The only other update I could state about that might come to your mind is that the Chore service and under CFC for our IDD client or ISW client, they will not require, we won't require a CAT assessment for that client to apply for and to be approved at some level for Chore services under CFC. So the idea of CFC is that you already met level of care for waivers, and then why have another level of care that's different than the level of care you already met for a service that's under CFC? Okay, some questions about the CFC part. What is the rationale to moving Chore to CFC? Okay, great question. The rationale here is the same as when we moved PCS for folks with level of care for waivers under CFC. CFC is a national option that any state can choose. All states like it because there's a slightly higher reimburse rate from CMS to that state for CFC services if they follow the rules of implementing CFC. So there's a lot of person-centered stuff in it. There was a lot of like development using our people we serve and groups and advisement groups and things like that. So then we were granted the permission to implement CFC. And so states like it because it has a slightly higher reimburse rate. So, most states are putting some services under CFC, and some of them are keeping waiver services. Generally speaking as well, some of the services that we provide to people in our world of waivers and CFC are billed under, I know this is the wrong word really, but regular Medicaid as opposed to waiver Medicaid. So what we do when we do that is we bill services that we can, or we construct it so that certain services can be billed under regular Medicaid, and leave the waiver Medicaid ones to certain services that are only available under waiver. And this is per constructs and regulations that come from CMS. So at the end of the day, we can show accurate costs of our waivers and accurate costs of our state plan Medicaid. So ideally, we'd be able to say that waivers, don't cost as much as they have been because some of the services would fly underneath, regular Medicaid. So basically, that's it. That's the rationale. States really like that. It helps us work for more people at the end of the day. Hopefully we can start to draw down some of that funding so we can work on behalf of more people who need our services eventually. Question says, can we have a peek at the letter? I would love to share that with you. I just, at this time, I can't. I just don't have permission. We worked on it. We worked on, the plain language part of it. Oh, good concept. Go ahead, Delight. Were you going to say something?
I'd like to see it too, Megan. Don't worry. Like, we'll see it. I'm sure we, didn't you say, Carol, we were gonna show it to them when it's ready? Like, I can't
When
remember
it's ready,
yeah,
yeah,
like,
I
we had
just
all
haven't had
logistics to
a
that.
yeah, today it's just because of all the things happening at once. I just haven't chased down the permission to share it. But when we do, we'll make sure that we have something to share to show you. But the important thing here is that we're mailing it to the person, right? So your client will get a letter, but you're going to get yours in Harmony. So that's pretty good, right?
That was the logistics. I was like, I know there is some kind of logistics to it. That's the logistics. Thank you.
Okay. Yeah. You're going to get yours, the care coordinator, you're going to get yours in Harmony. And so it's going to come to you as an attachment to a note. And the art and science of notes are probably better said by Delight than me at this point, but I could probably say it. But yeah, it's going to come to you in a note. So when your person gets that letter and starts to wonder, you can explain to them what's happening. Okay. What prior auth number will they use to bill Chore if it's not the support plan prior auth? Uh, Plans care getting more complex, more applications, CFC, other discussions about having different rates for plan writing. Okay, let's take a look at the website. I think I just had
I can
uh,
speak to the billing piece. So
mhm,
it's based on that January 1st date. So services after January 1st will have a new billing number, and then the services before that will have the old billing number.
mhm,
So that's really going to be how it's separated out. And
mhm,
it's going to automatically be changed over in, like, you're not going to have to do anything for your existing chore plans. It's automatically going to be fixed. It'll be when you renew, that new chore number will be available to you.
mhm. So there is a rate chart posted on the website, and it's got everything on it. So these are waiver services, I believe. I don't know, maybe it's everything. Let's see. There's a couple of them, so I probably opened the wrong one. Let's see. Personal care and CFC. That would be the one I'm looking for. I saw rates and I just went right for it. So this would have the new code. There'll be other opportunities for our provider and you to learn the new code too. But you can look at this and you can explore this. This is all on our website. And these would be the services that are PCS and CFC.
I guess my audio is getting wonky, so I'm just going to be the
Mhm.
voice in the dark.
Okay. So here's the chore right there, and it's got a different code. It's got the newer code, and this is effective 1/1/21. So you can see those and explore that at some point. All right, let's see. What else is there about CFC, perhaps? All right, the question about development of plans and different rates for development of plans. Ongoing discussion. I do not have any specific plans slash update slash, criteria for that type of a rate increase right now. It doesn't mean that it wouldn't happen or couldn't happen and has happened in the past, but I do not have information about that as of this moment. But you are correct there. The complexity has risen. So again, the rate stuff is informed by Office of Rate Review. It's informed by um, the cost information reporting that you do with the Office of Rate Review, um, and and some of it comes through our reg process. So there's plenty of opportunity to learn and comment upon it. Will a letter for Chore CFC go to all waiver recipients or only those who have Chore, who currently have Chore? My understanding is the same as Delight's. I understand it was only for folks that have Chore. Okay. I'm just going up here in time. Um,
We have a
yeah,
lot of App K questions.
I see
So
that.
we may want to take some
Okay.
time in our agenda for that.
Okay. Yeah, we can do that. So anyway, I just want to conclude this little nutshell about Chore because there are, moving to CFC, there are resources for you right there on the website that you can explore. And as always, we welcome your questions to SDS training at alaska.gov. We'll definitely be able to field them there. Emailing us there is great. We get a chance to route it to people who might know the answer better than us. So if you think of something later after the session, go ahead and write it in, or if you're watching this as a recording, email us if you have a question, sdstraining@alaska.gov. Okay, so next on my agenda here is new dehabilitation regulations. You may recall that our dehabilitation reg story over the years has included how to request, or the not how to, but the need to request more than the limit. At one point, it didn't have a limit, then it had a limit, right? That's part of the story. So there is there was imposition of a limit, of course, and then criteria for requesting above the limit, and this was related to a lawsuit. So certain individuals had an increase of above their limit amount for a certain period of time based on that lawsuit. And so the request through that whole outcome, the biggest part of it currently in this story is that, how do I know what the person requires, what circumstances must be at play if the person is going to request above the limit for dehabilitation. Okay. So that was requested to go into regulation. And so it went into regulation and it got signed and it came out. And here we have it. So I don't have it posted on, I don't have it posted here on the website. I have proposed DAHAB regs posted. I know that they were shared through, I want to say Basis, but Delight, you probably know better than me, the website that puts out like an announcement when there's a new reg, right?
Yeah,
They were shared like that.
it's actually
But
on, it's kind of weird, but it's all managed under the lieutenant governor's page. So you have to go
okay,
to the lieutenant governor's page for all the like ongoing regulations for everything. You can filter it down to just home and community based.
DHSS.
Yeah, you could, or you could widen it to all Medicaid, like, but you'd go
Gotcha.
to that area on the state website, the
And it's my understanding
lieutenant
that you can get,
governors.
yeah, you can sign up for their e-alert too. There's a
Yep.
way to sign up for their, it's a different, believe it or not, we have like many different e-alerts within the state, not just ours, but there's others, listservs. So you can join that listserv, but it's okay because I have our new DAHAB regs that have been signed in their PDF form right here. And basically they attempt to answer the question or give guidance around the question, what must be at play in order to request over the limit 624 hours a year. Now, nothing has changed about it. All the questions that you may have about, does this mean the person has to hold only to, 4 or 12 hours a week, or can they go above or below a little bit, but depending on if they were sick or something else happened. Nothing has changed about any of those rules. We speak about it in terms of an annual amount, but a person may be authorized up to that up to that point, that number, and it doesn't mean to imply that it's a yearly amount to be used outside of an average weekly amount. Okay. Um, so that's, that we still don't do banking of the service and things like that. Okay. In regs, it's trying to be a simple way of saying it, I guess. Okay. So the department will only pay it in the beginning of it. It defines DAHAB and things like that. It's got its definitions. This actually went into effect October 1 of this year. they became effective, but we are not reviewing support plans in light of these regs until the first of the year, first of the coming year. Just because of everything that's been going on and people using the Appendix K to renew if they, had no changes in their plan. Okay. So the questions that you may have, I'm not looking at the questions right now, but I'm going to shoot one out. I'm going to shoot an answer out. If a person has renewed an Appendix K and they had above the limit, renewed using the Appendix K form, and you did that, then during the time that the Appendix K is effective, yes, they will continue to have the above the limit. It's not going to change and go away for them come the first of the year. It's going to go throughout their plan year. Then the next plan year, we're going to review it under these particular regs. Okay, so there's that. Okay, so we'll only pay for a maximum of 624 hours, may approve a limited amount of additional day-hab if the department finds that, and I'm not going to read it out loud to you. You can see it here. If you would like a resource to either have a link to or get a copy of these, I could send that to you. I don't have a problem with that because these are signed and out. So we can find that resource for you if you want it. Okay. Recipients' current physical or behavioral condition places them at risk of institutionalization or incarceration if they don't have the additional day-hab. If their support plan and records indicate that they have a critical need for additional day-hab because of one or more of the following. And here is a list. The person has an acute or degenerative physical condition, which means they must participate in activities to maintain or improve that condition, and those activities are available only in the community. The person exhibits behaviors that create a risk of physical harm to themselves or others, which can only be mitigated by skill development related to appropriate behavior in the community. The recipient's one-to-one support was recently terminated, and they need to learn skills required for living successfully in the community. 13267 is the reference there. And I'd have to look that up. I'm not sure exactly what 13267 is. We could find it quick enough. I should, but I'd have to look it up. And they're released from an ICF for intermediate care facility for individuals with intellectual disability or the criminal justice system within the current or prior support plan year means that they need additional day-hab to learn skills for community integration. So that was the list there, these little numbers here, little Roman numerals, the list of things that the person has to have one or more happening. Okay, and there must be records of that. Support plan shows that. So the basic thing is that it places them at risk of institutionalization or incarceration, and that you have one or more of these, what's going on in this list. All right, so, and C, their medical, social, educational, or other records support their need and their capacity to engage in and benefit from additional active teaching or training. The records include the following, and you can see that support plan and assessments and other records, case notes and things like that. As far as requesting it for additional day-hab, they submit it in the support plan and telling how their physical or behavioral condition and one or more of the circumstances of this subsection 1B in 1B justify additional services, identifying goals and skills, listing interventions used to address their condition, and whether the interventions that were used in the past were successful or unsuccessful, and show how additional day-hab will not duplicate or supplant other services given to the person. So it's basically it. It has definitions, critical need, things like that. I guess the nutshell understanding here is that we have to show how dehabilitation will essentially help the person stay out of the institution or facility in order to request the additional day hab. So that brings me to training. Training is available, will be available to you for this, and we're going to put that together for you in December. If you go to our main calendar of trainings, you'll see that we have 2 sessions that are available to care coordinators. They are worth CEH. Okay, let's see what I'm looking at here in terms of my questions, and there might be a little bit here from our staff that I could share. All right, let's see. There's acuity. The person needs to have the acuity level for the additional day hab. Okay. Comment says reviewers are ending services as 12/31/20 per the e-alert issued previously. Services will not automatically carry over unless they request additional units. Please confirm I heard correctly that extra units will go beyond 1/1/21. My understanding of this, and this is, I mean, this is also subject to change because it, it could be different, but my understanding is that the person's support plan that they had renewed through their APK is an annual amount of services, and we're not going to end them if they go past 12/31/20. They're gonna that support plan was authorized for a year, an extended year under the Appendix K form for a support plan with no changes, including the ones that were over the limit for day hab. Okay, that is my understanding. All right, lots of questions here about that. Questions about if a doctor wrote a prescription or recommendation for exercise outside the home because of, for example, cerebral palsy, would that suffice as additional documentation? It would really help as far as documentation goes, but when we review it, we look at the whole package. I don't know that that would be the sole thing that would bring forth an approval of additional. In terms of circumstances amongst everything, it may, right? So again, we're having training on this and it will be worth CEH. So if you want to go ahead and check out our training calendar, we'd be more than happy to welcome you to our trainings in December. Can I post the link to access the trainings? Let's see if I can find that for us.
I can grab it.
Oh, okay. That sounds good. Yeah. And we'll have training amongst our staff too, staff who are out there. Feel free to give me words and things like that to share with people. But anyway, this is new day hab regs. I just really wanted to introduce it and just give you some framework around it. Let you know that there will be training and it'll be in December. That's my basic intent here today. All right. Quickly, we are moving to a new building in Anchorage, and I know we did put out an e-alert about that. We have a new address. Currently, we're still working remotely till further notice. Continue to use email to get us. If you need a phone call, we are more than happy to call you and talk on the phone or have a Zoom with you or something like that. The best thing to do is email us and ask us for a couple of times or give us a couple of good times to call you back. We'd be happy to call you back for that. But most of us have seen the new building. Some of us haven't, or actually managers have seen the new building. That's not most of us. So managers and supervisors have seen it. It's sort of kind of behind East High. And I want to say the address is 1835 Burgaw, but am I wrong? It's so new that maybe I'm wrong. I could be wrong. All right, I got it. Yay. Good guess. Same building as Conduit. Yes. And some people have told me that it's the old Alyeska building. So if you remember old Alyeska building, yes, we're on the 3rd and 4th floor. And that will be interesting and fun when we get moved in. And we'll go from there. Okay, so while I scroll up looking for other questions, Delight, did you want to provide an update on Harmony?
Yeah, well, and I just wanted to let you know that I tried to pull up the calendar and I didn't find those specific events. So we're going to let you know when those day hab training sessions come in. So don't sweat it. I will put in here the link to the training calendar, just so that you can peruse it for the rest of the year. So where are we with Harmony? We're actually really close. It's pretty exciting. We have the support plan almost wrapped up and ready to go. We're doing a lot of fine tuning of procedures and processes, and we're looking at onboarding piloteers in December. That's our target at this time, so that we can start vetting the materials and work through that. So that's really our like action orientation right now, is to getting things updated, moving, so that we can start having you guys like be able to give us feedback on it and start processing through it. We really wanted to take a minute to thank you for participating in that survey that you all sent out. You had some really interesting feedback we really, really thought was just like very insightful, and pretty excited at how excited most of you are. A lot of you guys are really pumped for coming into Harmony, and that's really great information for us to hear. So we're really excited to have you more engaged and more active in the Harmony system. So that's where we are right now. We're at the final layers of testing and fine tuning internally before we take the next step. I know we've said that for like months now, but you guys, it is unbelievable how complex things are, um, with our and just how technical some of these software systems are, and just making one little change has such crazy effects. So thank you for your patience, and it's been quite an adventure. So all in good fun though. We're excited to have you join us in this adventure soon.
Yeah, definitely. Thanks to my entire team for, going through all these different changes with Harmony. It's been pretty amazing to help refine the system. But we're excited about it. We're excited to present it to you and get you introduced. We are hoping to start our trainings with a small, very small focus group in December, and then expand it to everybody past that. And your survey answers give us a lot of food for thought, so that we can tailor trainings to best meet your needs. And we're hoping that we'll be able to get most of us through in the first part of the year. First quarter is ambitious, but as you become a comprehensive user of Harmony, once you've completed our training, that will be what you'll use. So you won't be using DSM to send us things anymore after that, related to plans of care or support plans. You can send us other things on your DSM, or ask us other questions on the DSM, but it won't be used as a main conveyance of documents for your support plans and applications and things like that. So that's exciting. I went back to the beginning to see our questions that you very helpfully put a flag by for me. So I'm going to grab some of those and do my best. There's one that says people on the Fairbanks Care Coordinator group said password protection would be taking off of a form, and I'm not sure what form, but which would be most helpful, as DPA cannot read it because of the password protection. Okay, recently it was decided that we're going to take away password protections from our forms so that a care coordinator can more easily combine them into one, so that you don't have to print them out and rescan them, just to add them all to make one document, one long document, if you will, like kind of like a pile of paperwork, but in a PDF form. So look for that. That was a lot of thought and careful conversation around what that was about and what it looked like. Originally, they were protected so that the forms couldn't be changed and things like that. But we do teach our care coordinators that not to delete parts of forms, just to leave them as they are. And if there are pieces uh, that don't apply to the person or reason you're filling it out, to please put not applicable there, so that we know you reviewed that question or whatever, and you didn't just skip it. But don't delete it, because then how would we know either way? So yes, we are taking away password protections on forms to try to make it a little easier to work with them. A lot of our questions are saying, do we have updated information about the emergency declaration ending 11/15 and status of Appendix K flexibilities? Is whether rumor is true that the Appendix K is extended, we can submit Appendix K plans for renewals that expire after 12/31/20, and if so, how far extended? As of today, we don't have any extension facts past that date, past 12/31/20. There are some relaxation of regulations that were, I want to say, local. They were like state decided, and the Appendix K the whole Appendix K implementation, not just that form, that came from CMS. So those two things are not totally in alignment, because as you know, there's a ending of certain um, emergency statuses on 11/15 that may be extended, and then there's the Appendix K that we applied for, which were 12/31 is the expiration date of that as of this moment. So we have to wait for our federal oversight to give us a word on that. We have to wait for our state oversight to give us a word in order to answer your questions. But I get it with the rumor part and things like that. It's just that as of this time, I don't unfortunately have an update on it. My best thought for our care coordinators has been to work on the traditional forms that you are used to working on, meaning the full support plan for waiver work past that date and application work past that date to work on your traditional application packet. So that is the best I can do. If things are, extended past then of course you'll know. And it may be that some of them, you know, maybe that you did a few in between that were full on forms. We always accept the full on form. Um, that's always there to use. It may be that you did some and then it was extended. Okay. I know nobody likes that idea or that thought, but that may be how it turns out. Okay. Questions, 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 and thoughts about that. All right. And thank you, team, for answering individual questions in person. So look for your answers if our team members, Sina Fisher and Delight Bells, have graciously answered your questions right to you. Is the Appendix K being extended along with disaster declaration? Are we supposed to be continuing with no contact visits? When might we hear? Okay, so the no contact visit is still permissible, and that's through its ending date is 12/31 as of this moment. People are doing socially distant visits, and they take all kinds of different forms. The visit on the porch, I know it's cold, but people are doing socially distant visiting, not necessarily going in the house, but making an appearance to the person. I've heard of, I'm not saying that this is the greatest thing, and you can laugh if you want. I have heard of people visiting in a garage because it's a bigger space, they're away from me. It's working for some people, okay? So I'm not saying you have to do that. I don't want anybody to say, Kara told us we have to visit in the garage. No, you don't have to visit in person. You can do a socially distant in-person visit if it is something that will work for you and for your person. and that's what we have right now. Stay tuned for updates as time goes on. If they're increasing, we know there are increasing cases, so there might be some changes. Regarding the relaxation of our state regs, they in the emergency declaration ending, it's possible that they could end pieces of the emergency declaration, but have other pieces continue. So there's that to think about too. It's not necessarily like everything is done on that day, but that is again up to our it's up to our governance to let us know what that is, and it's fairly frustrating, and that I definitely understand. But right now I don't have guidance about that past what I already said. Okay.
Can I just chime in real quick and say,
Yes.
guys, if you are seeing clients, please wear a mask. Please, 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 please. Just for you, for them, for everybody. Even if it's like, even if it means you have to explain to your client, like, it's really me, I'm just wearing a mask. You can be a great, you know, ambassador to mask wearing for clients as well. But you are a carrier. You are seeing our most at-risk clients. And this, the thing that's so hard about COVID is that you're the most contagious before you show any symptoms. So please keep that in mind. If you are like, we really, really want you to to avoid seeing people in person, but if you are, for whatever reason, it's cool. Just please, please, please wear a mask.
Hmm. Yeah. Yeah. And there's a comment, it is hitting the small homes. I have 3 in the last month with COVID and 4 total so far. All but 1 are asymptomatic, so that's good. Yeah. Yeah.
It's
We
just
don't want
crazy
to.
the varying degrees it can react. I mean,
Mhm,
it can really be, you can be asymptomatic or you can be in the ICU. It's just
mhm, mhm.
so crazy.
Question says, do I have an idea when there might be any further info on the extension of Appendix K? As soon as possible. I know our leadership is working on that. We get a lot of questions about that. Our leadership teams are always working on that, especially our director. He's involved with a lot of the health and safety COVID teams surrounding our population. So I hate to keep saying it, but our best thought is to just stay tuned, stay close tuned, and we'll let you know as soon as we know. This is a question that our good staff can help me with. Few folks are saying that they're getting due dates. This is Harmony's showing me due dates for reassessments. I'm getting them kicked back for too early. Uh, I'm I'm guessing that we're submitting our applications too early, and we are kicking them back if they're too early. Okay, so best question here is the submission allowed 45 calendar days or 45 business days prior
Sure. Hey,
to
Kara.
the renewal?
Kara, this is
Yes,
Tina. Can I butt in here really quickly?
of course.
Because these are two separate topics.
Okay.
Right. So yes, you might see a tickler that comes in and says your reapplication is due, send it in. You need to check your records for level of care for that client. We have said this every outreach now for 4 months. There are misfired ticklers in the system. We had a period of time where any document that was processed by SDS and the note was set to complete, it fired off the level of care application is due tickler. So when you see those, please check your own records before you just send it in. Okay, we do need applications to come in as close to the 90-day before level of care expires mark, right? That's the regulatory requirement. So 90 days before the existing level of care expires. If you're seeing a tickler that doesn't line with that, you're still at the 90-day mark. I really can't tell you how many ways have I apologized. Well, not me personally, I didn't build the system, but it did misfire that. Now, Kara, if you would go back to the other question about 45 business days versus 45 calendar days for turning in plans, I didn't answer it because, to be honest, I don't know. BUD.
I didn't know that. I don't know that either. Review staff, can you help us with that? Is it 45 business or 45 calendar? Any thoughts on that? And if we don't have a consensus, we can, ask and get back to people. Was this for level of care or support plan?
Thinking that's a support plan question.
All right, care coordinator said, yeah, support plan. Care coordinator says days, not business days. That's how it's always been. Days. Okay, our reasoning here is with our it's 30 business days, which equals 45 days when you include weekends. So it's both kind of 30
I just
business
like to,
days, but
I just
45
like to,
actual days. Go ahead.
I was going to say, I'd like to throw out for the group, we're seeing random answers coming in from care coordinators and SDS staff. I really want to this one sums it up. I found it depends on the reviewer. If they accept it for the renewal 45 business days or 45 regular days. Folks, this is why we're confused. I'm just going to leave it at that.
And so we welcome your written responses so that it helps us, align what responses should be. It helps us know too. More than 45 days ahead and it will be kicked back. And so our regulation says business days, but we allow 45 days, which includes the weekends and extra time. Okay, we have had the conversation of what is a business day versus a calendar day. Our regulation doesn't exactly specify that, but we defer to business days because it gives the care coordinator more time to submit. So 45 days, which is the target of that is 30 days ahead, but 45 gives you the ability to count it as calendar days. Okay. And there is a regulation attached to that. Thank you, staff. Yep. So the clarification is here for you. It is 45 days, which includes the concept of 30 days, business days, allowing you 45 at the max, which is able to include weekends and other extra time that different holidays and things like that could occur throughout the year. All right. And here's our reg. Thank you, staff. And I can just send it to us. All right. Okay, so we had that discussion about that, about the days and things like that. Did we have anything else that we wanted to bring forth today? Staff, anything? Delight, Sina, anything else we wanted to answer or bring up today?
I'm just gonna say it because I'm a huge nerd and really have a lot of civic virtue and encourage you all that if you haven't already voted, you should go vote. It's a big deal. That's what I want to bring up.
Vote. Yeah, awesome.
Please vote. Please
Yeah.
help other people vote. If they need help to get to a poll, encourage everyone to vote.
And then there's a note of appreciation for the quality improvement report for recertification. Yeah, quality improvement has been something that a lot of times it's difficult to, whether people don't understand or they don't have methodology for it. So now there's like a template or, a form that you can use and look for more training around certification and recertification to come in the future. Mostly we're just with our group here, we're going to get through our Harmony training, and we're going to do a little bit more of an academy style for certification and recertification. If a care coordinator does not see a note in Harmony about a submitted support plan and or required document, should we contact General DSM? Email to confirm documents were received. Do I wait a week? You can always follow up to be sure we got it, so you could email. I ran a special needs ballot today. Easy process and got to skip one of the lines. How cool is that? That's awesome. Medical doctors completing VODs or other documents, qualifying diagnosis form. Some have not been seen due to a biomedical doctor due to COVID. Any tips on that? I would think that our doctors would, it's our understanding that they're not super duper busy, but that could change any moment. You know, to sign, that they would sign because the person needs the service. So, and you can electronically sign, which probably hopefully makes it a little bit easier. There were some questions around care coordinator visits. I think there was one up there that said, you know, what if the home doesn't allow the care coordinator in? I guess I want to go try to find that one. So generally the answer, if I can't find it, I'm sorry, but generally the answer would be our homes are also working under licensing. Okay. Oh, okay, here it is. How does the SDS plan on handling assisted living homes who refuse to let us in the home to visit once we're required to see our clients? This is assuming it's during winter. Okay, so the homes can't, like in a non-COVID atmosphere, homes can't refuse a visit, you know, to your client. That would be a quality assurance report, like right away, you know. For visiting in person during the COVID time, homes are working directly with licensing on people coming and going and visiting and things like that. So since our numbers have recently risen in Anchorage, then there's different requirements for homes, and they may be working directly with the licensing requirement. So I would say, you know, that would be a manifestation of that home's requirements as demanded by, or whatever, as given by licensing for not visiting, that type of thing. And so some homes have gone back to hunker down and some homes have not. Hard time getting VODs and QDCs back in Fairbanks, and the doctors might not sign them unless they've seen the patient within the previous 12 months. I don't know. I don't have certain answers on that. It is always possible to request a visit by telehealth if they do that. You know, so the person or their guardian could make an appointment, and that might be something that could happen. I'm hearing that the clients don't want to go out and the doctor just go to the doctor just to get the renewal document signed. They feel the risk is not worth it. I don't know. If it was me, I might ask about a telehealth option if they have it, or a phone option. I know that they're doing, I know that offices are doing both. They're doing phone consultations and they're doing telehealth stuff. So you might ask the office, or the person or their guardian or somebody could ask the office about, hey, you know, this is for a document. We need to check in, and just go from there. VODs they need to be no more than 6 months old. QDCs are good for 12 months. All right, comment. I'm concerned about becoming a super spreader amongst our assisted living homes, even in a garage. If I should pick up COVID at ALH 1 and take it to ALH 2, you pick it up from there. COVID could be in every ALH in a week. It is scary. It is. So that is why we have the option of virtual visits or phone calls. So again, it's not up to, you know, that might not be allowed in an assisted living home, you know, to visit anywhere. I just said that they're working with licensing, so you may not have a visit at the, you may not be able to have a visit at a home. I'm just saying that we're not saying you can't do it, but you could do it, but it needs to be socially distant, and you should use the safest option at all times. Yeah, good comment. Some medical clinics are not copying medical records due to skeleton staffing. Will NFLOC accept reapplication without medical records? Not past 12/31 at this time. So we're asking, you would have been getting them now. So if they're not copying medical records due to skeleton staffing, I don't know. I don't have a good option for that right now at this moment. You'd have to work with what you had, I guess, because of the conditions that are going on. You just have to work with what you had. Let's see. If the K is not extended after 12/31, then will we need to go back to in-person visits? That's also another part that may stay. I mean, some of the, I'm not going to say that this is a guarantee, but some of the conversations with CMS have been around things that have changed in your state due to COVID that would work for your state when there's not COVID. And so virtual visiting from a care coordinator has worked. So that might be something that we would be very interested in continuing. But that takes a whole team of people to say, hey, it's continuing, but it is something that we're interested in looking at for continuing. That and other options for virtual services like the virtual day hab and things like that. Again, no guarantees, but it is one of the promising practices of COVID restrictions that is a silver lining, I suppose. Some homes don't have internet services for telehealth and or visits from families. Again, it may be possible to use the phone. I certainly have had people have phone consultations with their medical provider. Question on or comment from a care coordinator on not being able to get copies of records. Just ask for the most recent chart note and they'll usually do that. Maybe they think you're wanting to dredge up everything under the sun and they're like, no, we can't do that. We don't have the staff. Good thought. Not a fan of virtual visits. Our people suffer from isolation and depression. I get that. Thank you for the thought. Don't see the trainings you mentioned for Dayhab on the calendar. Okay, that's fine. We just didn't get them on there yet. Sorry. I thought they were going to be on there, but I'll work on that today. Get them on there. It may be, that we were just updating the calendar in general. So my apologies for that, but I've got them in webinar. I just have to put them on the calendar so you can register. It's the extension is a high priority. It'd be great if we get it granted and communicate it. I agree. All right. Hang on, let me get to the end here. Let me say I will email you that. Person asking for a reg that's sort of kind of off topic. Oh, wait a minute. Sorry, I missed it. All right. Okay. Okay, cool. Yeah, and the advice about the most recent chart note for our medical documentation is a good one. So a few of us are agreeing on that. Okay, so it's a minute after the top of the hour. I want to go ahead and close our session. Thank you for being part of our discussion. Hopefully we've provided some helpful information to you and you can